Hear without.
I can't hear without these
from
things.
the United States of America.
We're broadcasting live.
What's that?
Woo! Love Trey. He's got cue cards. Want some?
With a DNA sample.
Hi guys.
Got a hot steaming batch right here.
This is my favorite one right here. I haven't made that one myself. Friggin' girl.
You're listening to Connections Relationship Radio.
Hey guys. Ready for the soft opening? 5, 6, 7, 8.
Get up.
Or Osaka, Japan. I don't know.
This is Connections.
Soft opening.
Connections.
Soft opening.
Connections.
Soft opening.
You really asked you that? About the headphones? What are you wearing on your head, Doc? I'm Uncle Martin. No? Too old of a reference?
Yeah,
Okay.
my favorite Martian.
There you go.
Bill Bixby, who was the Martian?
Ray. Oh, I can't think of Ray's last name. Hi, everybody. Somebody help me out. Ray, the guy that played my favorite Martian.
The Martian.
Yeah, Ray. What's
Yeah,
his? I
the
can't think of his
title role.
last name. Oh, I need more volume in my ears. How are we doing here?
I could use a little bit more.
I
in
could
my
use
ear,
a
too.
lot of
You
volume.
need volume?
Yeah, I do. I need more volume. I am not loud.
I need more cowbell.
More cowbell.
Yes, more cowbell is the best,
I had more wasabi today.
especially during sex. Can you imagine? Ding, 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 ding. I mean, it's a
Well,
good beat to stick
yeah.
to.
Well, your old man will say, "What? Is it
No,
all
he's used
over?
to that.
Is it done?"
No, he's
you know,
used to that.
And you're saying next, ding,
No.
ding, ding.
He's
Ding,
used
ding.
to that. That's normal out in the country.
All right. how's it- Hey, everybody. Tonight we're going to be talking about hormone. There we go. Thank you, Tommy. Hormone replacement therapy and what the hell it is, what it does, and why it's so important for some of us. Where's Linda? I know, right?
She's got her coupon someplace.
Something's coming
Yeah,
in.
you're
She's
gonna-
a frequent flyer.
Yeah,
until she-
you're gonna wear that one later.
Well, probably. Yeah. Actually, no. I think she was making what we call Mama's margaritas in the other room, so she'll be all right.
Mommy needs her medicine.
Mommy's medicine. That's right. So that's what we're going to be doing tonight. We're going to talk about hormone replacement therapy. We're going to be answering some of your questions, unless they're like totally stupid. And then we'll just
I love it.
point and laugh.
Yeah. Say
You were
they asked
so
what?
funny.
It's true. Oh, no, I don't want to download. No.
Oh, you didn't hit that button.
I did.
Oh.
Oh, dang it. Yeah, no, that button. You ever do that?
Yeah.
Yeah.
Oh no.
Back when the internet first started, when I was a youngin'. Yeah, people, we used to get these phone calls. I've downloaded it, but I have no idea where it went. And that was back when you put the AOL card that you got, the disc that you got in the mail like once a week. You put that in there, and I was like, I think it's just going to an automatic file that says downloads.
I
But
went to an anything but closed party one time, and somebody wore AOL discs.
you can do that.
Yeah.
Not those parties anymore, though. Yeah, you can't do those anything but closed parties now. COVID's ruining everything.
I know.
All right, when we come back, we're going to talk about the hormone replacement therapy. And yes, Linda Ball, Mama's margaritas are great. Stay right there. We'll catch up with the affiliates and catch you on the backside.
If you have diabetes and you're on Medicare, Medicaid, or have private insurance,
You got the diabetes. Poor William. You knew where I was going, didn't you?
Yes.
Wilford
Ooh.
Brimley.
Ooh, no.
Ooh, that's loud in our ears.
Yeah, that was pretty loud.
Okay. All right.
Yeah, I used to have hearing in my right ear. I do not any longer.
now you can automatically
You did it to yourself.
I did. Well,
the painful
not since I've been married.
No? Really?
to have a new CGM. We'll do all the insurance paperwork for you and deliver the newest in diabetic care technology right to your door. Take charge of your diabetes today with the help of a new
That's it. I'm not letting him touch anything. No buttons. You're not allowed. Yeah, it's really loud, and it's just, yeah. Hi, Karen. Hi, everybody. Thanks for joining us. Here's about, what was that? My ear?
It wasn't me.
It was me. Almost better than under. And don't you be banging over there, young lady, or I'll put you on camera. Okay, so hormone replacement therapy, very important stuff today. Also, we've got the doc with us, and that always means good times because, well, now Dr. Dave is, he will be this weekend for more than 15 minutes on the weekends with the News Radio WFLA Orlando.
Yeah.
Yeah, it'll be fun.
A full 1 hour show.
Thank you, Walston. Damn it.
What happened?
Ray Walston.
Oh, Ray. Oh, well done. Damn it. I got to put this thing away.
Yeah, you're dangerous.
I am dangerous.
Mm-hmm.
Yeah, you crank up the volume and now you can hear just about everything. So, yeah, Ray Walston.
Turning you down. Ray Walston. My favorite Martian. Did that show ever go color? Or was that too early?
Yeah, that's a good question.
I don't think it did. I know my three sons did.
We didn't have a color TV set until I was in college.
We didn't have a TV.
Yeah.
Hey. All right.
Well,
Live from the Connections Studio Suites, it's Connections. Connections is relationship radio.
Darn right it is. Let's start. What? Oh, hi. Hello, everybody, and welcome to another installment of Connections, relationship radio with a twist. Mostly the twist is I'm a little twisted. I'm Melissa Fox. It's true story. I don't make this stuff up. Hold on. Do we have my... No, I turned him down so much. We have hashtag Lizzie said what in the house, of course. Give us a little wave. There
That's
you go.
me, boy.
It is you. And, of course, our favorite doctor, Dr. David Klein from Stages of Life Medical Institute in beautiful, sunny downtown Longwood.
Yes, and my wife Tess here, who otherwise known as Marcel.
Marcel, yes. She's a silent mic usually.
Yeah, there you go.
Until after the show, in which case then she unloads on Dr. Dave
And
on the way.
we can't keep her quiet.
Yeah, we tonight are going to talk about hormone replacement therapy. The show is titled WTH is HRT.
Yes.
So, what the heck is it?
Okay, it's actually kind of a little trick that we can do to help women and men actually deal with a little trick that life puts upon them as they start to get a little age past maybe 30.
Tricky life.
Tricky, yes. The trick is this, that as women get older, their hormones change. Actually, that never really stopped since they hit menstrual age. You know, the estrogen goes up, progesterone goes up, it goes down, it goes up and goes down. And for the better part of their adolescence and much of their early adulthood and much of their middle life, their hormones are always shifting and makes them miserable, or it makes everybody else around them miserable, or
right.
both.
And they're unaware.
Yeah.
That's the worst
Well,
part.
no, I mean, so it's one of these kinds of things where, for the longest time, I kept a wooden mallet and a stake in my office, just waiting for my daughter to act up because it was such a miserable time during ovulation and menstruation.
A steak.
Wooden stake and a
should
mallet.
kill her.
Yeah. If, where's Van Helsing? We need to bring Van Helsing in. Yeah. And so what's it all about? And so people think, well, it's all about estrogen. It's all about progesterone. Well, the fact of the matter is, you need to understand that it's really more about the combination lock of life, and that these hormones, they are in balance, they're synchronous, they are in harmony, or you go to heck in a handbasket. So what are we looking at? So as women get older, this is, the menstruation, ovulation cycles aside, estrogen levels decrease in levels as women get older until they disappear. They go lower, 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 like a limbo bar, and then disappear. Looking at menopause. And if that's not bad enough, progesterone decreases with age. It goes lower, 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 and disappears before the estrogen does. And that's important because there's an estrogen to progesterone ratio that gives you hot flashes. So people say, well, it's got to be the estrogen giving me a hot flash. And the answer is yes, it is, but really only in relationship to the progesterone. So the treatment of hot flashes is very different than the treatment of just basic hormone imbalance. So if that were not cool enough, and I find it to be really neat because it's fairly easy to get rid of most hot flashes. But then testosterone decreases in men and women with age. And that also influences the way the body works, in particular thyroid. So if you didn't think it got more complicated, it does.
It is.
Estrogen, as it decreases, TSH, thyroid stimulating hormone, decreases. So you end up with false diagnosis of having a normal thyroid. So women, as they get older, can be hypothyroid. They can be profoundly hypothyroid, But because they have no estrogen or very little, their TSH doesn't go up, and the doctors make misdiagnosis because of the lack of understanding, sometimes known as ignorance, of the relationship of the gonadotropins, things like estrogen, progesterone, and testosterone, on thyroid hormone balance. So if you're going to go into your doctor's office and get balanced, okay, it's not like going into the tire joint. You can go to Tires Plus. They'll balance your tires just fine. They'll even put the air in there, but they can't do much about your old lady. So how do you balance these things? Well, you start by finding out what the levels are. And this doesn't mean spitting in a tube.
No.
So people out there think, well, I went to the X, Y, and Z doctor, and they had made me do saliva testing, which is absolute nonsense. What you need to do is to get good old-fashioned blood levels to see where you are. That is where it starts. So what hormones do we need to look at in order to properly diagnose anybody with a hormone imbalance state?
Well, that's what I was going to ask. We have a Facebook listener said 2 years ago her levels were checked. So what levels?
2 years ago is an eternity.
Yeah.
Yeah, how about I check my patients every 3 months.
But what levels should they be checking for?
That was a marvelous segue into what I was about to say, which is, thank you, nicely done.
Very.
So, and we didn't rehearse that, okay? So what I prefer to do is to do the usual stuff that people come in and look for, which is estradiol, progesterone, testosterone.
Okay.
Then on top of that, we're going to look at T3, T4, TSH, antibodies to thyroid, TP and ATG, to see whether or not the thyroid is throwing off the estrogen, progesterone, testosterone axis. Two more are important here.
Hold on. You see I'm glazing over a little because all these letters came out, T's and H's and G's and stuff. So lay woman for it, me.
Okay. So what happens, yeah. So what these are names. These are letters that are assigned to hormones, and they're polysyllabic names that are sometimes difficult to pronounce, and they're even harder to remember sometimes. So TSH would be thyroid stimulating hormone. And so a lot of the docs think, well, that's the gold standard to tell you whether or not you're hypothyroid. And you can usually, when you hear that, you need to look for an extra crease in their palms and an extra digit.
And another doctor.
You got it, okay? Because that is the furthest thing from being true.
Okay.
All right? So TSH is not the gold standard of anything. And if you ask even further, is there one hormone called thyroid stimulating hormone? And the answer is no. It's actually a family of hormones. Many different TSHs exist. Some of them are stimulatory, many of them do nothing, and some of them are inhibitory. So it's one piece of fact, it's one piece of datum amongst a myriad of things that you need to look at.
Okay, so
But
most
what
of the
about?
time they're selling you short by only doing just a generic TSH.
Ignorance is not bliss.
No?
Okay, what else can throw off gonadotropins? And the answer is cortisol. What else can throw it off? So if you don't know your cortisol level, you don't know what you're doing. Pregnenolone can throw it off. So when you're looking at somebody in particular the first time, you need to look at the pituitary, you need to look at the gonads, you need to look at the pancreas, you need to look at the parathyroids. So you have to look from top to bottom to see where the difficulty is, because just as it is in an engine, you have 8 cylinders, 12 cylinders, 6 cylinders, 4 cylinders, 16 cylinders. If any one of them goes wrong, nothing is balanced.
Lizzie, stop looking